So a bit of background from how it was in my first year. So I was placed in Grooterschuur Hospital Ward G16. It was a medical ward. So on the first day, we were expected to be at the reception area at the hospital at 7 o'clock. And then once everyone was there, we were taken into a separate ward in the hospital. And then we had different people from the hospital, like your occupational health and safety person. We had one of the sisters from the ward, and they were telling us about different policies that occur in the hospital. What happens in an emergency? Should you get pricked by a needle? Should you faint, get sick? Just the whole general rules of thing, just general rules that you need to know as a student. And obviously they spoke to us about dress code and that sort of thing. And then from like 12 o'clock, 1 o'clock, we were then separated into the different wards that we were working in. On that day, most of our supervisors were there, so we got to meet the supervisor that you'll be with for the duration of your placement. So your supervisor is actually meant to come to you majority of the time that you're in placement. So as we were working a Monday, which was once a week, so every Monday my supervisor had to come see me so she can just ask what's going on, am I enjoying the ward, whatever I learned, then obviously book me for different procedures that I had to do, which was a baby wash if you're in the pediatric ward and a full wash if you're in the adult ward. And then later on during the year, I had a vital sign procedure, and then we also had urine analysis. And yeah, that was it. So obviously your supervisor is going to be there, you get to meet her, you get to exchange numbers. Sometimes they'll create a WhatsApp group with you so that we're able to have constant communication with her. Anyway, I'm digressing here. So after that whole introduction thing that we had with the hospital staff, then we get separated into our different wards, and then usually you'll be about 2 students per ward. Sometimes it can be more, but majority of the time it's 2. So once you get to the ward, you'll be assigned to the sister, and then the sister in that ward will assign either herself or someone else to give you a tour of the ward. Then they'll show you where the different cubicles are, the sluice room, the linen room, storeroom, the doctor's office, that sort of thing. And then obviously you'll be taught how the whole ward works, the routine of it and stuff like that. The very first day is going to be a half day, just introducing you to how the whole ward works and that sort of thing. And I have to put this disclaimer here, guys, please expect anything and everything on your very first day. I've heard stories from students that on their very first day, especially if you're working in a medical ward, they had their first death and they had to do last offices. So last offices is just a procedure where you clean the patient and you wrap them up after they've passed on, and you just prepare the patient for when the family comes to see obviously the body viewing and that sort of thing. And then obviously people from AVBOB and sometimes the family themselves to come fetch the body and that sort of thing. So for me, I guess luckily I never had that experience on my very first day, but I know friends that had that. So please be aware that this might be your experience on the very first day. So that's how my first day was. Anyway, so let me just give you tips on the very first day and obviously the days going forward. Please make sure that you ask questions. I know you're going to feel like you're a nuisance and you don't know anything and you're being annoying because you're constantly asking so many questions. But the thing is, you're a student, you don't know anything. This is your very first time being in a practical setting, whether it's a clinic and it's a hospital. If you do not understand why certain things are happening, please ask, and do not just leave your questions for the nurses. If you see a doctor, a physiotherapist, a dietitian, and they're doing something that you do not know, I've never seen before, go watch them do the procedure and ask questions. Majority of them are more than willing to help you and make you understand what is going on. So please make sure that you're asking questions. Even if you're asking one question more than once, please make sure that you ask it and you understand it. But obviously there's a limit to the number of times you can repeat the same question over and over and over again. And then obviously if it's not explained to you properly, you're more than welcome to ask your supervisor and do your own research. Second thing is obviously the very next time that you come back for your placement, please make sure that you come early. This is a big pet peeve for many nursing staff is people come late. And the reason why you need to come early is nurses, they work 7 to 7, whether that's night or day. So obviously if you're coming for the day shift, the night shift, they want to make sure that by 7 o'clock they're leaving the hospital. So if you're coming exactly at 7 o'clock, you're going to delay the whole process for them and they're going to leave late. Usually from 6:30 and sometimes from 6:45 in the morning, they will have what is known as handover. This is when the night staff, which is usually just a system, gives information to the day staff of what happened to the patients during the day so that we know what to expect from our patients. Obviously, if a patient had a bad night, we need to know that during the day. That will affect how we treat them and also helps us able to tell the doctors, look, this is what happened during the night and you need to deal with this certain issue. Because as nurses, we are with our patients literally 12 hours of the day, 24/7, since it's both shifts. So we know what is going on with our patients. So we need to be able to know what happened during the night so that we can communicate it properly with the doctors in the morning. So please make sure that you attend that handover. It also makes it easier for you to know what is going to be happening during the day, because you get to learn about your patient's condition and just a brief history about them before you actually start, so that you're not overwhelmed and you don't know what is going on because you've heard what happened during the night. Because when they do handover, literally this is how it works. This is patient so and so, diagnosed with this and this and this. They're on this medication, and during the nights they had this amount of urine and they ate this amount of water, and their condition is satisfactory, continue with treatment. Or the condition is not satisfactory, their blood pressure was spiking, they had a high temperature, this was the medication that was given to remedy that. And as a day staff, we need to obviously keep monitoring that patient, etc, etc. So if you attend handover, you'll be able to know what is going on with your patients, so that you're able to know what treatment and care to give them during the course of the day. So please make sure that at least by 6:45, whether you're working day or night shift, you are ready in the hospital. So please do not be arriving at 7:15. Arrive at least a few minutes before, so that you can put your stuff away. You can do a little prayer should you need to, whatever you need to do to get yourself ready. Pick your stuff so that you have all your pens and your equipment on you, and you get into the ward and you're ready for that handover. And I probably should mention this while I'm talking about handover. During handover, yes, there's going to be a lot of terminology and abbreviations that are going to be thrown your way about what is going on with the patient. I know it's really scary the very first time. Down below, I've linked a few abbreviations and terminology that you'll hear often, whatever ward you're working in. That should definitely give you some guide so that you know what you're expecting. But relax, take down the terminology, and later on, as a sister that you're working with, or even some students, usually you have older students that are there like your second or your third years, sometimes even your fourth years, that to be working there. You can ask them and they can explain it to you. Sometimes even on the walls in the ward, they will have those terminologies and you can take them down, or during your tea time, you can do your own research and find out what all those things mean. While you're busy learning in the ward and getting your competencies together, please make sure that the things that you're doing are within your scope of practice. Yes, I do realize that with a new nursing program, there really isn't a set scope of practice, but just use the old nursing program as a guide for what your scope of practice is. So a scope of practice is pretty much the things that you're allowed to do in each year level. And if you do things that are out of your scope of practice, if you're under supervision, it's fine. You have someone watching you. But should something go wrong and you did not have supervision while doing that thing and it was out of your scope of practice, you can get into so much trouble. So yes, these sisters will allow you to do certain things that are out of your scope of practice. For example, in your first year, you're not really allowed to do injections, but some sisters will allow you to do it. If you're doing it under supervision, it's perfect. You can do it because they're there to monitor you. That's why they are there. But should they assign you to do something and you are alone and there's no one watching you, please rather avoid doing those things, because should anything go wrong, it would be on your head because you had no supervision. Please make sure that whatever you are doing for your procedure, it's according to how you are taught in skills lab. Because what happens when you get to a hospital, in skills lab, your procedure for giving medication takes 30 minutes. In the hospital, it takes 5 minutes to give medication. So you can see there's a big difference between how you're taught in university and how it actually is in university. So you need to be aware of those differences. So when you're doing your procedures with your supervisor, make sure that you're doing it to the T as how you're taught in university. But obviously in hospital, things are a bit more fast-paced. You don't always have all the time in the world, and you can use the shortcuts that you are taught in the hospital. But please make sure that you're still keeping the fundamentals of your procedures. What I mean by this is, during your procedures, when you're doing anything in university, they'll always preach to you that you must introduce yourself, you must get consent from the patient to do whatever you're going to be doing, make sure that you identify your patient, etc., etc. So those things must still apply, even though you might take out a few things out of the whole procedure. Just make sure that the basic fundamental of it is still there. Another very important thing is, guys, please attend your clinical placement. You've got 4,000 hours. Well, this is for our course. I'm not sure about the new nursing program, but I'm pretty sure it's pretty much the same. You have 4,000 clinical hours that you need to have by the time you graduate. And if you miss out on any hours, you have to work them back either on a weekend, and it just messes up with your normal schedule with university, because university is already busy and you do not want to be taking extra time out of it. And also, if you do not end up making enough hours by the time you graduate, you would delay your graduation. So if you're supposed to graduate in December, you might actually end up graduating in April, because you still have to catch up on your clinical hours. So by all means, I know we all get sick, we all get very exhausted. There's a lot of things happening trying to juggle clinical placement and schoolwork, but by all means, please do not miss your clinical placement hours. It will really come back and haunt you if you miss it. So please do not make petty excuses why you can't go to placement. Obviously, if an emergency happens, like a death of a family, an accident, you get robbed, or you get sick, there's obviously procedures that you have to go through with the university to get a deficit letter. But should any of those not apply to your situation, please make sure you're going to placement. I know you'll be tired, you'll be exhausted, especially during your exam period or just before your exam period. There's a lot of assignments being thrown at you. I know we are all tired, but it's really going to mess things up for you, especially if you have to take extra time so that you can make up the hours that you've missed, and also it delays graduation. COVID is already delaying things for us. Do not create extra work for you even further. Another really important thing that you need to be doing during your placement is show eagerness and initiative to learn. Nurses are more than willing to teach people that who want to be there in the placement than people that are just there because they need the hours. If you're there, be excited, be willing to learn. If you see a curtain is closed and you're not doing anything, pop your head in, see what's going on, watch the procedure, get your hands dirty, I guess I can put it that way. But be willing to put yourself in learning opportunities and to learn different things that are happening. And it doesn't even have to be in your own ward. If you know a patient is going for a colonoscopy, or they're going for a CT scan or an MRI, etc., etc., ask if you can escort the patient. Especially with your confused patient, they usually ask the students to do that. Even if it's not a confused patient, ask the sister if you can go with, so that you can see what happens around you in the hospital. That way you get to learn about the hospital and the other disciplines that are happening around you. Even if you see some physiotherapist students or your occupational therapists, dietitians, go with them and see what they do. So that way you're able to learn the whole holistic care of the patient, and you're able to have different information that will help you to provide the best care for your patients. Please be aware that you're going to make mistakes. Obviously, avoid the big mistakes like having someone die, giving the wrong information, giving the wrong medication, and that sort of thing. Obviously, those major ones avoid. But mistakes do happen. Should they happen, own up to them and take the consequences that come with them. And obviously, apologize to whoever was involved, whether that was a patient's family, the patient themselves, or the doctor or the nursing staff, and that sort of thing. Just be aware those things will happen. You will feel really guilty and terrible in the moment, but it will really show how mature you are if you apologize and you deal with the consequences that come with it. So be aware that those things are gonna happen. It's not the end of the world. Every nurse has many mistakes, but that's how we learn. We learn from failing, getting up, and trying again. So those are all the things that happen during placement itself, the type of attitude you need to have, the things you need to be doing, and that sort of thing. After placement, there's obviously a few things that you need to do. The very first thing is take it all in. The very first day, it's going to be a lot. Information overload. You're going to be so overwhelmed, just going to be very confused. Take it all in, breathe. If you need to write it all down for it to make sense, do that. And I know at UWC, I'm not sure about all the other universities, but I know in your first day you've got a reflection portfolio that you need to do, where you sort of pretty much have a diary entry of everything that happens in nursing. Use that to be able to get all your feelings out there. If you're frustrated, upset, angry, excited about anything that happened during the day, record it and put it all down and just get it all out. And especially if you experience death on the very first day, you need to take the time to process all that. We all deal with death differently, and it's going to become more frequent as the time goes on. So you need to make sure that you've got a hold of your emotions the very first time it happens. Speak to someone. There's counseling services that the university offers for you. Speak to your friends, speak to your parents. Just process all the emotions that you're feeling. Another thing is record your first times. Record the first time you do your blood pressure, the first time a patient says thank you, the very first time you give medication, etc., etc. Those are all wonderful things that you want to record. Trust me, you're going to want to know when was the first time you did this, when was the first time you did this, especially if you've got your reflection journal, and if you look back on it at the end of your course or even in your second year, just to look at how you are feeling at that moment and where you are now. Trust me, those very first times are needed. And should there be an opportunity to take a photo, obviously with consent, trust me, take the photo. You will really want to have that picture when you're doing your graduation or at the end of your course, to just reminisce on what has happened during your journey into nursing. And the very last thing is, should something have gone wrong during the first day or the days coming on and you mess up on something. I remember the very first time I had to take out an IV from a patient who was getting discharged. I pulled it out and I don't know what I was thinking. I didn't think the blood would splurt out, and it did, and the patient started bleeding out and I was freaking out and that sort of thing. Those are things that happen. Obviously, if you're under supervision, they'll be upset with you the very first time, or some will even laugh with you and that sort of thing. Should any of those embarrassing things happen, don't beat yourself about it. That's a learning process, okay? It comes and goes. Everyone has had those moments. Even the doctors and the nurses, they've all gone through those moments. That's part of the learning process. So definitely don't beat yourself up about it. Hopefully this video will help you out in the first few days and weeks and months and years of clinical placement. Trust me, it's going to get better. You're going to get more confident as time goes on, but I really hope this video will just help you to calm your nerves so that you're going into placement a little bit more prepared. If you have any more questions for me, definitely comment down below and I'll answer all of them. Or if you want a bit more private conversation, you're more than welcome to message me on Instagram or Facebook at Silibaziso Mupereki. Until next week, Friday, 12 p.m. South African time, have an awesome first day of clinical placement. Bye.